Vascular and endovascular surgery is a branch of medicine which treats the diseases of artery, vein and lymphatics. Arteries are the one which takes the good blood from the heart to the every other part of the body, and veins are the one which takes the bad blood back to the heart to get it purified. And vascular and endovascular surgery is the specialty where it deals with or it treats the diseases of arteries, veins and lymphatics. Commonest diseases which affects the vascular system are peripheral vascular occlusive diseases, aneurysmal diseases of the blood vessels, and the commonest venous diseases are varicose veins and DVT. Commonest symptom of these vascular diseases are pain and cramps in the leg, swelling or edema of the legs. Commonest symptoms of venous diseases are dilated and tortuous blood vessels in the leg. They get swollen limbs, itching, discoloration, pigmentation, or a non-healing ulcer in the leg which is very resistant to heal. So how do we diagnose these vascular diseases? An examination by the vascular specialist will clinch the diagnosis. So to treat these vascular diseases, we need to have a further imaging modality. Common modalities used are arterial and venous Doppler, peripheral angiograms, or CT or MR angiograms of the limbs. How do we treat? Etiology for this is the lifestyle and the risk factor management which causes these peripheral vascular occlusive diseases needs to be treated. So this forms the basis of the treatment. First is risk factor management. The smoking is the commonest etiology for all these vascular problems. So quitting smoking itself forms the 50% of the treatment, or many a times the condition itself will get cured. Other things are diabetes and hypertension, which adds to the vascular diseases, needs to be optimized. These are the patients will have long-term diabetes and hypertension, so we need to have an adequate control of diabetes and hypertension. The other commonest cause for this vascular problem is hypercholesterolemia. That is because of the cholesterol. Increase in the cholesterol, the blood vessels will get clogged by this atherosclerotic plaque. So once the cholesterol is controlled with these medicines, automatically the blood vessel circulation will be improved. Next will be the lifestyle changes. So obesity and reduced activity are the one which causes commonest to aggravate these vascular problems. So reducing weight itself cures half of the vascular problems, and keeping yourself daily activity and eating a healthy, nutritious, balanced diet forms the main form of the treatment. So anyone who is diagnosed with the vascular problems need to be physically very active. At least a 5 kilometer walking daily will cure all the vascular problems. The medicine which are commonly used are blood thinners or the antiplatelet agents. These are ecosprin or the clopidogrel, which makes your blood thin, so it improves the circulation. Other medicine which commonly used are silastazole, which increases the blood supply to the leg by forming alternative collateral channel. Other commonest medicine what we use is the statin. That is the medicine which to reduce the cholesterol, so that the cholesterol which is accumulated in the blood vessel will shrink and improves the circulation. So the risk factor management, lifestyle changes and medicine forms the basic treatment for all vascular problems. If the disease doesn't get cured, or the symptom aggravates, or the patient himself presents with advanced diseases, then they might end up in having some form of intervention, either with minimally invasive endovascular procedure or an open surgical procedure. So endovascular is a minimally invasive procedure where we gain access to the vessel through a small needle or a hole inserted in that over the wire, and we open up the vessel by doing balloon angioplasty, or in case sometimes a stent may be required to keep the vein open for longer duration. Similarly, aneurysmal disease of the blood vessel, that is a ballooning of the blood vessel. So it keeps on ballooning, which over a time ruptures and it can cause dreaded bleeding. So in case such things also, that's aneurysmal diseases, can be treated endovascularly by putting in covered stent graft. So we bridge the balloon with a stent graft system, that is a covered stent graft system, so that the natural lumen is restored and the risk rupture is reduced. Venous diseases which affect the commonest among the population is the varicose vein, which is prevalent worldwide. About 30% of the population has got this varicose vein. In among the 30%, 1% of them will require some sort of treatment. So all these varicose vein patients we treat initially with exercises, massage, medicine, stockings. Even if after this medical treatment, if it doesn't get cured, or if it progresses, or it causes advanced diseases, then endovascular treatment is the option for varicose vein. These are endovenous laser ablation and endovenous radiofrequency ablation. These are the two forms of treatment where through a small needle a catheter, that is the laser catheter or the laser fiber, is passed, and this fiber tracks wherever the varicose vein is there, and it ablates by using thermal or radio frequency energy, so that the dilated vein will get collapsed and the varicose vein subsides. These two are minimally invasive procedures which are done under local anesthesia as a daycare procedure, so that the patient comes in the morning, get the treatment done under local anesthesia, and after 2 hours the patient can go back. Surgical options. In case of advanced vascular diseases or vascular trauma or an acute clot inside the blood vessel, the surgical options are also available. That is, in case if it is not possible with minimally invasive endovascular technique or a non-surgical technique with medicine, we might have to do a surgical procedure. If the vessel is injured by trauma or an accident, we might have to repair it inside the operation theatre. If the acute clot is formed, we might have to take the clot physically. And in case of long segment occlusive diseases, surgical options are bypass the occlused vessel. We at Apollo Hospital have got a comprehensive vascular care facility where we have an hybrid OT theatre facility in which all complex vascular diseases are treated with ease and 100% success rate. Thank you.